Welcome back to Millennium Live, the leadership and discovery podcast, where today's top minds share insights that shape the future of technology and transform the digital enterprise. And in this episode in particular, we're diving into one of the most urgent questions that's facing healthcare and talking about AI adoption and why perhaps AI adoption is stalling, even as, we've discussed all year the excitement around this, which is continuing to grow. And to have this discussion today, I'm happy to bring on Mara Lederman. She is the Chief Operating Officer at Signal One, which is a awesome partner of the Millennium Alliance and a company that's at the forefront of AI in healthcare. Mara brings such a unique perspective on health systems, their overall technology implementation. Had the chance to meet her last year at the Millennium Alliance Payers Providers Assembly. So Mara, it's so exciting to have you on the podcast and pick your brain a little bit about the transformation that we're seeing in today's healthcare space.
Fantastic. Connor, thanks for having me. It's good to be here.
Awesome. Yeah. And key topics that we're going to be diving into, talk about, helping health leaders who maybe, first stepping into the AI deployment and the difference between AI management and governance, which is something that Signal One is keen to, and why that nuance does matter. And of course, how to balance innovation and risk without slowing down progress. I think a good way to start is to discuss, that many health systems are piloting dozens of AI tools. I haven't had one podcast this year where we haven't talked about AI, and but really only a handful really are making it to scale, and that's kind of the key differentiator there. So what's going on with AI adoption? What are you seeing out there in the market? Why is it stalling? And perhaps who is best to help this situation?
So I think that's a great place to start, Connor. And I think we're at a unique moment in time for AI in healthcare. I wouldn't say adoption is stalling, but I would say scaling in progress is coming very slowly. And if you look at what's happened maybe over the last 12 to 18 months, we've seen many health systems pilot a large number of AI tools. These may be tools they've built themselves, things that they're acquiring from vendors, or things that are bundled into their electronic medical record system. But where they are now is kind of an inflection point. They need to move from this pilot phase where they try stuff, where things are highly decentralized, where champions within the enterprise, whether it's an ED doctor or a radiologist or someone within the revenue operations, brings forward a tool to kind of try and pilot. They need to move from that phase to what we might call enterprise-wide deployment, or AI on an industrial scale. That's what every other industry has or is in the process of going through. And that's where healthcare is right now, trying to move. The leading systems are trying to move from having tens, and in some cases, maybe over 100 sort of AI projects, to setting up a scalable, repeatable, professional kind of AI operation that allows them to more quickly try tools, find the ones that work, measure that value, and then scale the successful ones while rolling back the unsuccessful ones. And I think that's where we're seeing what feels like perhaps a stalling, but really it's just this need to kind of move from one paradigm of AI management to a new one.
Mara, you and healthcare leaders know better than anybody, how things change and the pace of change in healthcare. And when it comes to technology implementation, what makes AI fundamentally different from traditional healthcare software? And particularly, why does that difference just demand new governance models?
I think that's such an important question, because I think we always hear two things. On one hand, we hear everything about AI is different. We need to do everything differently. And then you hear IT leaders say, why do I need to build a whole new process for AI? We've been project managing and operationalizing technology in our health system for years. Why is it different? And it's hard to figure out how those two things kind of are both true and coexist, even though our gut is there are things about AI that is different. And so it's helpful to be really precise about what I think makes AI different. And it's not just that AI feels magical. I'll explain to you why it does feel so magical. And it's not just that the pace of progress is so fast in AI, though that is true. And it is probably true that we are seeing faster progress in the technology right now than we ever have before. But at a really fundamental level, AI is different from other software because it is probabilistic, while most software is deterministic. So that sounds like a mouthful of statistical jargon. So let me unpack it for your listeners. Think of Excel. Excel is our classic piece of software. It's deterministic. If you ask Excel, what is 3 plus 9? The answer is 12. It's always 12. It doesn't matter how many times. It doesn't matter if you ask or if I ask. It doesn't matter if we ask on a Thursday or a Sunday. The rules of arithmetic mean that Excel is always going to tell you that 3 plus 9 is 12. So when you go to buy Excel, yes, you need to make sure your tool like Excel works, and it's going to have upgrades and you're going to need to train people, but nothing about how it performs is going to change over time. On the other hand, when you have an AI-based algorithm, it is not using rules to tell you the answer. It is making a prediction. And the prediction is effectively its best guess of what 3 plus 9 is based on all of the data it's looked at in the past. Now, of course, we're not asking it questions like 3 plus 9, but when we ask AI to predict something like, is this patient likely to become septic? Or to predict what is a summarization of this very complex patient chart, it is making its best guess of the answer you are looking for. And sometimes that guess is going to be wrong. This is why ChatGPT warns us, that it makes mistakes. This is why we talk about things like hallucinations, with Gen AI tools. So fundamentally, AI-based software has these unique properties that require different governance. Property number one, just because it works in someone else's hospital on their data or on the data that the vendor validated on, it doesn't necessarily work the exact same way in each new hospital. It has to be what we call locally validated, right? And that's just not the case with Excel. Like if the math is right at one hospital, the math is right at another hospital. Second thing, once it works, it's still going to make mistakes. And so it needs to be monitored to understand how often those mistakes are happening, if they're happening in a systematic or a biased way, and to make sure that if the performance or quality of the tool changes, the system is on top of that and can fix it. And so that's why it requires a set of governance structures that we haven't had before. And if you talk to hospitals now and you say, what is like your biggest pain point around AI? One of the things they say is we have this backlog of AI tools and vendors that our stakeholders want, and we can't work through the validation of them quickly enough. Because unlike traditional software, you can't just turn it on, you have to validate it. And that creates an entirely new function within health systems that they didn't need to have before, right? The AI assurance or the AI validators.
I really appreciate you taking the time to discuss why it matters. And not, as you said, not all cases are the same. And just because we've been talking about AI all year, one of the things that often goes left unsaid are misconceptions. Curious about, from your point of view, what are the biggest misconceptions that you encounter when health systems just first start thinking about monitoring and managing AI at scale?
I don't know if it's so much as misconceptions or it's just really new. And so they're trying to wrap their head around, how do I do something I never had to do? I didn't have to monitor the output of the software I've bought before. I think it's a matter of them wrapping their head around, how do I start setting up a function like this when I didn't have to do it before? And so I think some of the challenges, and I'll reframe maybe misconceptions as the things we hear health systems say is hard, even understanding how to kind of risk score different types of AI tools to determine what type of monitoring is necessary. So things that are patient facing obviously have a higher level of risk. Things that impact clinical decision making, things that don't have a human in the loop. But that's not, there's tons of AI that's being used in the back office, in revenue operations, in scheduling operations that maybe needs to be monitored differently. And so even setting up a complete but a usable kind of risk scoring framework or matrix for AI tools that right away can then dictate, how do we need to manage these different types of solutions? That's new and hard. And that's one of the things we see health systems struggle with or, seek guidance on. I think a second thing, and this maybe I will put more in the kind of misconception, is operationalizing that. When you have a few AI tools, you can operationalize these things with people and spreadsheets, right? But you can't do things at scale. when they're very manual and when they're governed by things like spreadsheets or Google Forms or sort of, software that is not designed to be used across a large number of technology solutions, and that doesn't include automation. And so I think maybe one of the misconceptions we see, and this comes back to where we started about this inflection point, that the sort of processes and technology and workflows that health systems have put in place to manage AI in, let's call it this pilot phase, the 0 to 20, 0 to 30, that they're appropriate for the next phase. They're not appropriate for the next phase. And it requires, like I said earlier, kind of a paradigm shift, right, to a much more tech-enabled, automation-enabled set of workflows. If you're going to have, and many health systems say they want to, hundreds of AI tools, including AI agents, functioning within their enterprise. So I think that's maybe the biggest challenge or misconception we're seeing right now.
And I think that covers some of the management aspect of all of this. And I that's a point I want to get to from the intro of this podcast. But, Signal One often talks about AI management, while you also hear a lot of the times the term AI governance. Is there a difference between the two? And if there is, I'm sure you have a good explanation to why.
Yeah, Connor, I'm glad you asked that, because it's something we've thought a lot about and we take very seriously. So anytime there's like a new area, there's always this explosion of vocabulary, right, around the area, and certain terms become very buzzwordy and everybody anchors on them. And no doubt the term AI governance is an important one. I'm not saying it's just a buzzword, but it's certainly become one of the terms we use a lot, and people use it to mean different things. At Signal, and I'll come to it in a minute, but at Signal One, we use the term AI management. And the reason we want to use the term management is because management is an active term. When we think about managing, we sometimes think about maybe managing a portfolio or managing our customer relationships. But management sort of construes the idea of having all of the tools and information you need to make resource allocation decisions to drive outcomes. And that's how we want people to think about AI. Let me layer up, I think, from the idea of AI governance to AI management. We think about three core capabilities that we think health systems need to develop around AI, and we're seeing them get there, some of them at different paces and in different orders. The first is this idea of having an AI strategy, and most health systems are starting to put together something like an AI strategy. Some of them, I think, misconstrue it and say, what is our strategy for AI? And that's not really what we mean by an AI strategy. An AI strategy is, how will we use AI to drive the outcomes our health system is looking to enable? So it's not a strategy for AI. It's how AI drives the broader agenda of the health system. And the best health systems who are doing this have already linked their AI projects and AI goals to the health system's sort of, most strategic objectives. So that's your AI strategy. It's the outcomes you want to drive with AI. It could be better patient experience, or more efficient asset utilization, or less turnover from staff. Or it could be narrower outcomes like becoming a regional leader in a particular line of service. But those are broader outcomes you want to drive with AI. Then you have AI governance. Those are the guardrails, right? And you need to put guardrails around AI for the reasons we talked about. But it is the policies, the procedures, the system of accountability you build around your AI. So you set up your strategy, and then you try to kind of implement your strategy within your framework of guardrails. Then you have your AI operations. And this gets at what we were talking about, like a misconception. You have to operationalize both your strategy and your guardrails. And so these are the people, the processes, the technologies that let AI work in practice. AI management, Connor, is the intersection of those three things. It is how you bring your strategy, the things you want to achieve, your governance, the guardrails you put in place, your operations, how you actually make this stuff work together such that you see a return on the money you invest in AI. And that's what we're trying to enable through our company and through our product, to give them a system for managing AI for both value and safety, as opposed to just a system for operationalizing guardrails.
I kind of want to build off all the points that you just mentioned, Mara, and it's an exciting time. I've loved talking about this in a variety of industries too, by the way. Everybody's trying to do the same thing, particularly in healthcare. as exciting as it is, healthcare is the industry with the most sensitive data, I think. And so it's the best way. How should health systems think about, balancing this excitement, this risk and reward, so to speak, when deploying AI? And you really have to ensure the safety without compromising or slowing down innovation.
No, I think that's exactly right. And that is the challenge around AI. And it's easy to, I think, yo-yo to either extreme, to get so caught up in the power of this technology that you kind of throw caution to the wind and say, we are all in, or to get so caught up in the risks of this technology to put so many guardrails and frictions in place that you never achieve the benefits. And healthcare can't afford to do, it can't afford to do either. It can't afford to be reckless. It also can't afford to not innovate. So just taking a step back, before I talk about how you balance, I think there's a real imperative to use technology like AI in healthcare. It's not a nice to have. It's not anymore on the side of the organization. It is becoming fundamental to driving some of the sort of I would say to addressing the biggest sustainability challenges that health systems have. Right? It is a real period of margin compression for health systems, obviously on both the revenue side, but also on the cost side. And there is no world where traditional approaches to management, like hiring more staff or building more beds or squeezing out a little bit of length of stay, without using technology, is going to solve this problem. And we've seen this in other industries. The real productivity gains come when technology is used to sort of deliver products and services in new ways, not just by layering a little bit of tech, on traditional ways. And that's where healthcare is. I think right now they are trying to balance, how do we use this technology within kind of our traditional model of care delivery to find some much needed efficiencies. And these will come through things like efficiencies in the back office, in the rev cycle, perhaps some labor cost savings in certain types, in certain areas, in certain classes of jobs. Other efficiencies that may come around asset utilization, let's say scheduling ORs more efficiently so there's no downtime, dealing with obvious, revenue leakage like missed appointments, no-shows. All of those are uses of this technology kind of within the traditional ways of delivering care. I think the second thing we're starting to see is using this technology to enable newer ways of delivering care, virtual nursing, more remote patient monitoring, more care at home, smoother transitions, outpatient surgeries that are enabled by screening and then post-surgical monitoring. So just to frame, like, the opportunity is not just innovation, it is, I think, existential to the industry. So how do you balance it? I think you balance it in a few ways. Number one, you go in eyes wide open. Instead of talking generally about the risks of AI and falling to the sort of hyperbolic headlines that we see in the newspaper, it's a matter of going solution by solution and understanding what actually are the risks with this solution, given the type of AI and given its intended use within our operations. What is it we're worried about? How do we evaluate the solution against that risk? And how do we put in guardrails for that particular risk? So that's number one. Get out of the hyperbole and understand, you're looking at the risk of falls, predicting what are we worried about? Are we worried about predicting too many people who will fall? Or are we worried that we'll say someone isn't going to fall and nobody checks on that? It's the second one. So how do we build guardrails specifically around, in that case, a patient safety risk? So I think that's number one, is getting out of the hyperbole. Number two, obviously, is starting with lower risk use cases, right? Use cases where there's always a human in the loop, use cases, that aren't yet impacting care. That's another way to balance. Build your muscle for using and monitoring this technology before you expand, to other places. And the third is, we don't want to be scared of the most novel tech. Some of the applications coming out around generative AI and agentic solutions is where the biggest impact is going to be. We don't want to be so scared. So starting to build a proper AI governance and AI operations function that can do things like monitor agentic AI or proofread summarizations is the way you're going to have the confidence to deploy some of those maybe seemingly higher risk, but higher reward solutions. Those are some of the things we suggest.
Great suggestions. Having these conversations with so many different industries, like, in marketing and others in healthcare and in finance and HR, I mean, the list goes on. I wonder if there are any parallels that healthcare leaders can draw from other industries like cybersecurity. Talk to how many cybersecurity, I at least do one cybersecurity podcast a week. So when it comes to portfolio level oversight of AI, are there any similarities or any points that healthcare could take from other industries that are implementing AI just the same way?
Yeah, I think it's a great question, and in some ways healthcare is unique. Obviously, the
Right.
stakes are very high if there are mistakes. We're dealing with people in the most vulnerable points of their life, or times in their life. The data is incredibly sensitive. The people who work in healthcare are themselves experts who have trained for a very long time to make decision making, to make the decisions they're empowered to. And so there's a lot that makes healthcare hard and unique. On the other hand, we've seen, I mean, not just with AI, but even with other innovations, that they do generally kind of work their way through industries, at least in some similar ways. And so first with the comparison, to other industries, our company, has some roots in financial services. My co-founder was a chief AI officer of a major financial institution before and took that organization, on their journey from no AI to now talking about generating $1 billion of incremental margin every year from their AI center of excellence. And so, he sort of saw that 0 to 1 there, and we've seen it in other industries as well. And I think there are a few things that are common and that healthcare can learn, and that healthcare is learning, right? I think the industry's made incredible strides. And so, especially over the last 18 months, the way we've seen executives embrace this. So I don't want to say that healthcare is, so behind here. Searching for the right use cases is hard. Sometimes what feels like the obvious places to apply AI doesn't end up being, the most valuable. And so if it feels like it's taking time for health leaders to find that use case that delivers immediate ROI, that's often the way it plays out. And so to be okay with that, there's some experimentation that has to happen. I think a second thing that can be learned is you have to invest in infrastructure. You have to invest in not just the use cases are the sexy part. They're the shiny objects. The algorithms and the use cases, those are the ones that downstream drive value. But where we started is you can't have 100 of those use cases without the infrastructure. The infrastructure is less sexy. Moving data to the cloud, building an AI governance process, putting in place an AI management platform. None of that's the stuff that makes the front page of the newspapers, the way the robots or the applications are. But it is absolutely fundamental to being able to do this at scale and to not eat up all of the benefits of the applications with really kind of messy and inefficient underlying AI operations. So those investments need to happen, and we're seeing health systems do that right now with they started that on data analytics with the move to the cloud. They're getting there. I think a third thing is to own their risk management approach. There's a lot of industries have a balance of external compliance and internal compliance. It may ebb and flow depending on how the states and the feds, the stance they're taking on regulating, but determining internally what it takes to approve a model for use, to, is it safe to use? Is it safe to continue using it? At the end of the day, regardless of what's being done externally, every organization has to take a stand on that. And I think we're seeing health systems get there, some faster than others, and others, that need help. And then the last thing I'll say is being relentless about measuring impact. The impact may not happen right away. And in some cases, it might be harder to measure. But what we often see is like a great business case being built around an application with all these promises of value. And then it gets deployed and nobody measures the things that they built the business case on. And again, that's part of the problem we're trying to help health systems solve with technology, but be relentless about looking for the outcomes that were promised when the solution was bought.
I do want to talk about effective monitoring, just because it's absolutely critical, because it directly impacts patient safety, the quality of care, compliance, operational efficiency, the list goes on. So, Mara, just in your view, what does effective monitoring look like in practice?
It's an important place to spend a little time. And it's one of the things we brought up earlier as kind of one of the things health that is at least new, right? It is new to AI in a way that didn't have to be done before. And that's why, systems are working really hard to set this up. And it's a hard conceptual problem. It's also a hard technical problem, right? To monitor solutions that are live, right? Just think about what goes on when you run an AI tool. It is drawing data, it's generating a piece of output, a prediction, a note, a categorization of an image, whatever it might be. It's then embedding that in some workflow, and then it's doing that again and again and again. It could be doing it every hour, every 15 minutes, And so the idea of monitoring something that is constantly running, it's hard. So let's just start by that. It is hard and new. So when we talk with health systems about effective monitoring, there's three components. And I'll say every solution is monitored differently. A predictive algorithm versus a computer vision algorithm versus, a Gen AI, let's say summarization versus an agent taking an action. I don't want to get into for each one of those how you monitor, but step one is defining what are you monitoring and what are you monitoring for, right? In many cases, vendors will provide that first level of monitoring or recommendations on what should be monitored. But at the end of the day, we've seen a lot of health systems who say, we want to monitor more than what's recommended. We want to monitor longer term outcomes. We want to monitor compliance with the tool, not just outcomes. So effective monitoring starts with, what am I monitoring and why? And health systems will, they can either get recommendations, they have people who know how to do this, but that is step one. Step two is then operationalizing monitoring. What you can't have is somebody pulling data every week or every day and creating manual reports. Again, 2 or 3 solutions, you can do that. We've seen health systems who try to do that beyond 10, and now their entire data science team is just doing monitoring and not building models, which is what they want to be doing. So how do you actually operationalize pulling out, let's say, the output of a model, comparing it to the ground truth, coming up with a set of statistics that, summarize how well the model is doing, comparing it to sort of a performance range that, is decided is appropriate. All of that, that's engineering work. That's one of the problems we try to solve with our platform. That is technical work that needs to be done. It's hard and everybody knows it's hard. And then the third part is saying, well, what do we do with the outputs of monitoring? There's no point monitoring if there's nobody there to act on the output of what you've seen through your monitoring. And so that means designing workflows, much of which could be automated, and systems of accountability towards people whose job it is to monitor the output of the monitoring and act on it. And sometimes the action might be automated, like this model's out of range, we turn it off. It's that high risk. In other cases, it may be we pause and, investigate, or we retrain the model. But it's really, just to make it simple, it's define what you're monitoring and why, operationalize the data collection, including the creation of dashboards and, other systems to view, and define a set of workflows and a system of accountability to action that.
There's a lot to unpack in this episode, Mara. Just your insights here has been very valuable to our audience and to the Millennium Alliance. And I always like to end the podcast on a look to the future. And hopefully the future is bright. I think it is. I think this technology is fascinating to talk about, which is why I love doing this. Specifically in healthcare, there's always change, and the pace of change could be sometimes very slow. Where do you see AI playing the biggest role in healthcare? It's going to be 2030 and 5 years from now. Where do you see this going? There's all this technology, and where is it having the biggest impact?
So always a hard question, right? And the thing about predicting the future is you're never back with the same person to be accountable for it. But I'll tell you where I hope it goes and where I think some of the biggest opportunity is. I think we need to deliver healthcare in different ways. And by way of background, we didn't say this, but I'm an economist, right? My career before launching Signal One, I was a professional economist. And so I think very much about the economics of how we deliver healthcare. And I learned so much because I don't come from healthcare, from all of the healthcare experts that I've spent time with since starting, our company. And so many of them talk about the potential to deliver care differently, to move more and more care out of acute care settings, to do more care as outpatients, to enable more recovery and rehabilitation, and things like infusions and treatments at home, to bring nurses back into the workforce who maybe don't want to work 12-hour shifts in hospitals, but would love to be nurses in a virtual setting or visiting patients at home. So for me, I think, one of the biggest opportunities around this technology in healthcare is to enable shifts to these lower costs, but at the same time, higher patient experience and potentially higher staff experience models of care delivery. I think that is like a win-win-win, and it's so rare we can point to something that is good for costs and good for patients, and good for staff. So I see that as one of the biggest opportunities. And I think one of the others is just sort of consumer empowerment. And people talk a lot how in every other sort of consumer customer facing industry, people have been empowered with their own data to make their own decisions, to have more personalization. And healthcare is trying to get there as well. So how do we use AI to both personalize the experience, but really engage patients much more as partners in their own care than they can be in a lot of this sort of traditional patient provider style relationships. So I'll hold those two up as I think two of the most promising areas.
I think that's great. That's awesome, and it's going to take all of us to get there. And I appreciate you, Mara, coming on the podcast and just sharing your wealth of knowledge. And I love the Signal One team. Everybody there is just an innovator and really transforming the industry. And of course, to our audience, I appreciate you once again listening to another fantastic episode of the Millennium Live podcast. Whether you're a hospital, health system, C-level executive, or even a clinician, just curious about the emergence of AI and tech in this space, or you're in policy, you're in governance, all of us are here shaping the future of healthcare. And this is just one of those conversations that I've really enjoyed. So, Mara Lederman, thank you so much for joining Millennium Live. It's great to see you again. Please, let's stay in touch.
You bet. Thanks, Connor. It's been fun. We enjoy hanging out with your team as well.